Bore da pawb, croeso I Iechyd Gyrff Cymru a Lansiad. Fy enw I Amarantha. Good morning everyone and welcome to Green Health Wales, The Launch. Thank you for joining us today. We are recording the morning session to be hosted on our website, so please let any of your colleagues who could not attend know that they can catch up, maybe as part of a departmental teaching session. My name is Amarantha Fennell-Wells. I'm a dentist by profession and I'm the first Welsh Clinical Leadership Fellow in Sustainable Healthcare. I have spent my fellowship year on a number of sustainability issues for Cardiff and Vale UHB, including education, action plans, and more specifically, nitrous oxide mitigation. And then I thought, why not organise a national conference to keep momentum driving towards our hefty targets for 2030 and beyond? Progressing with any project concerning sustainability in healthcare requires mentorship and support, but most importantly, engagement and collaboration. This is why we have founded Green Health Wales, an independent grassroots network of people in healthcare, in clinical, non-clinical, administrative, support and managerial roles across Wales who recognise that the climate and ecological emergency is a health emergency. We stress that we have received no funding for this network, paying with our personal time, and as such, our website and resources are still evolving. So who is Green Health Wales and what do we want to do? Green Health Wales aims to connect, learn and transform. First, to connect across Wales, transcending geographical borders while supporting cross-departmental collaboration. We aim to learn more about the healthcare sector's relationship with the climate crisis and empower everyone in the health and social care sector in Wales with the tools and knowledge to address the climate crisis, ultimately transforming healthcare to be climate smart. To begin connecting based on geography, please click the Jamboard link in the chat box that should be appearing and let us know who you are, where you are and what you do, but please use the platform responsibly. We invite you to learn from our expert speakers about the science of the climate and health crisis in session 1. We hope you'll be inspired by the exemplar groups in session 2, talking about their transformative sustainability efforts. If you have any questions for our speakers and panelists, please use the Q&A function on your Zoom screen to submit them. We'd also love to see your thoughts and comments popping up across social media. Tag us in posts on Twitter @GreenHWales, as well as our other hosting bodies, the Centre for Sustainable Healthcare using @SusHealthcare and the Bevan Commission @BevanCommission. Can we get these hashtags trending? We understand everyone attending today is on their own journey. For those who are starting with us today, we want you to believe that you have a place and a role within the context of sustainable healthcare because you do. We look forward to meeting you in Workshop A, hosted by the Centre for Sustainable Healthcare. For those who have already started their journey, we'd like to amplify your voice and take the next steps to develop your work. So much is being done and it deserves to be heard, adopted and spread across Wales and the global community. We need ambassadors across Wales to keep challenging the status quo, demanding our healthcare service do no harm to this planet we call home on behalf of the patients we're treating now and those patients of future generations. We are also asking our NHS and public sector executives to play an important role. Inspiring the workforce needs more than just a token gesture. It requires high-level support and a new cultural approach to be embedded within the system. We hope the 50 execs attending Workshop C this afternoon feel that this is indeed possible. In summary, today is just the start. The launch of Green Health Wales aims to leave you feeling positive and inspired by the bigger picture, confident in your role in the process, however big or small, and wherever that may be. And most importantly, feel empowered both by what's happening already and your own ideas. Our vision is a sustainable healthcare system that protects the health of people and the planet. What do you think our next step should be? If we hold this event this time next year, can we have the number of ongoing projects increase twofold, fivefold, tenfold? Can we deliver care in a way that maximises positive health outcomes and avoids both financial waste and harmful environmental impacts while adding social value at every opportunity? We think this is not just worth trying, but an essential roadmap to the future of both health and healthcare. I'd now like to introduce our first keynote speaker, Dr. Andrew Goodall, CBE, Director General for Health and Social Services and Chief Executive of NHS Wales. Dr. Goodall oversees the delivery and performance of the NHS in Wales, supporting corporate responsibilities and collaborative working across Welsh Government. Dr. Goodall states that a clear and ambitious green recovery will be a key component to how we respond following the COVID-19 pandemic.
Bore da and diolch yn fawr iawn. Good morning and thank you very much. And I just wanted to say at the outset that I'm really grateful to be given the opportunity to attend this Green Health Wales event and to be part of a team setting the context for the really critical conversations that you'll be having during the course of today. As you will all know just by joining, climate change is a globally defining challenge of our time, and it's a matter that transcends political and social boundaries. And as others on the panel will clearly set out, it's the most vulnerable in our communities who are increasingly impacted. And these are the same individuals that so much of our health and social care system are dedicated to supporting. And it's also an issue that hasn't gone away whilst we've been dealing with the other globally defining challenge, of course, of COVID-19. And as we start to build towards recovery, it's important that the environment and our impact on it is hardwired into our mindset as leaders and for decision-making at all levels, from the front line right up to the ministerial decisions that are sponsored on behalf of the NHS system. I'm also struck actually about how much more visible the conversations and the actions that are taking place around climate change and decarbonisation are. If I was just reflecting on the last week, it's really been an ongoing feature of conversations that I've been involved with, from ministerial conversations right through to discussions that I've been having with the NHS as well. And I would just offer to all of us that at a time of change and when we are looking to point our NHS and care system back into an appropriate setting, we do need to focus on areas that provide some system and staff energy to make a difference. So in 2019, you'll be aware that from a Welsh Government perspective, a climate emergency for Wales was declared to help trigger more focus and greater action to meet the climate change challenge. The effects of climate change pose significant risks to human and environmental health, and many of the social and environmental determinants of health, clean air, safe drinking water, and sufficient food and secure shelter are key issues for us to address. And it makes this a health and a public health issue for us to focus our time and attention on. As far as the public sector and health are concerned, what does this really mean for us in terms of how we step up and show that we are discharging our responsibilities? Well, Wales now has legally binding targets to deliver the goal of net zero emissions by 2050, alongside an ambition for the public sector in Wales to be net zero carbon earlier by 2030. And it's worth saying that these are collective targets, which does genuinely mean that we are all in this together in every sense. And to achieve these targets, we need to start now. We need to focus on acting differently, and we need to try to utilise some of the foundations in place, but to make sure that we are acting differently. And as a minimum, we collectively need to achieve a 37% reduction in emissions by 2025 and 58% to stand any chance of reaching the 2050 target. The NHS may always generate emissions by the very nature of its operations, and I accept that we are technology hungry as we chase after new practices and interventions on behalf of our patients and our population. But in my view, we can work hard to reduce them by re-looking at our buildings, our land use, about mobility and transport, our procurement approaches, and fundamentally the design and delivery of our healthcare systems, including different access points for our patients. I do believe that there are some foundations in place even before the 2019 legislative target here in Wales. We already had levers to start the process of embedding the decarbonisation agenda in the way that we work. And the NHS Wales requirements, which are our responsibility under the Wellbeing of Future Generations Wales Act 2015, ensures that the climate is considered at an everyday decision-making level. And of course, you will have Sophie setting out her clear expectations and standards based on these legal duties on the one hand, but also the moral and ethical need to act alongside the legislation. But I do think that this world-leading legislation places NHS Wales with a duty to support the 7 wellbeing goals put in place by the Act. And decarbonisation has a critical role to play in meeting this duty, in particular to achieve a resilient, healthier and a globally responsible Wales. So with climate change, pollution and detrimental health linked, it's the responsibility of NHS Wales to act on the climate and health emergency to support a healthier Wales now and into the future. The recent refresh to a healthier Wales, which is our 10-year long-term strategy for health and care in Wales, recognises this important link to the wider determinants of health and now includes a specific action on decarbonisation. And I really want to make sure that the NHS steps up I was reflecting ahead of talking here today that we have experience in Wales of leading. We have acted differently in many respects. Currently in the pandemic response, we're seeing Wales leading on our vaccination rollout and approach on a global basis. But Wales has also been leading on key issues tied to the climate change agenda, just seeing the way in which we've responded to the recycling duty, and again are amongst the highest and the best performing across the whole of the world. So the NHS needs to have the appetite and the opportunity to be acting in this space. So as the Chief Executive of NHS Wales, I want to talk about what role the NHS in Wales can play in this global challenge. We've already baselined the NHS Wales carbon footprint. For 2018-19, the footprint for Wales was around 1 million tonnes of CO2 emissions, a slight 5% reduction from 2017-18. And that footprint equates to an estimated £2 billion of direct NHS Wales spend. Health boards are shown to cover 87% of emissions, with 13% attributed to our NHS trusts. 62% of those emissions come from procurement, 21% from building use, and 17% from transport. And these health emissions are the largest of the public sector. So it really re-emphasises again the role that the NHS must step up to play in Wales for us to make sure our contribution happens. And we have used the data in the carbon footprint to develop a key part of our overall planning. Even during the height of the pandemic response and the actions that have taken place around that responsibility to act for the Welsh population, we did publish in March the NHS Wales Decarbonisation Strategic Delivery Plan, which gave us opportunities to look again at the emission sources across the NHS. And in a comprehensive manner, it contains 46 initiatives for decarbonisation based around the 3 phases of the public sector route map. So that's 21-22, moving up a gear, 22 to 26, well on our way, and 26-30, achieving our goal. And the strategic delivery plan is intended to change the way in which we make decisions, develop our business cases, implement policy, and ultimately provide healthcare. And we will need to think of what is prudent and effective for the patient, but alongside that for the planet. And there is more to do. The strategic delivery plan is a big step forward, but it doesn't cover social care, wider primary care, or policy development. And I want to be open that we will be focusing on those areas and ensuring again that they are targeted and support our actions. We will all need to show leadership and commitment to evolve our plans, and most importantly, of course, deliver the milestones that are set out in them. So how are we looking to deliver this? Well, no one is saying that reducing 1 million tonnes of CO2 emissions is going to be easy, and the change for the NHS is significant. However, with 100,000 employees, NHS Wales can influence through not only the way we conduct our business, but also the huge leadership role we have in terms of the interactions our staff and patients have with friends, families, and wider society. And we can and should lead the way. And we are doing that. NHS Wales is clear in understanding its baseline, in having targets and having a plan so we can help. But we also need to recognise that it's a collaborative approach with social services, local government, and other public bodies. And there are also a number of innovative approaches already taking place across the NHS, led by dedicated and passionate individuals and teams. And we will have an opportunity to hear and reflect on this work throughout the course of today. For some aspects of the plan, I would hope that we are a little ahead of others, but we all need to ensure that we maximise the impact that we can make to reducing emissions over the next 9 years. And that isn't very long at all. Think back to where we were all 9 years ago, and it becomes imperative that we begin to act now. What we need clinical buy-in to is we need to change the way healthcare is designed. And it's really great to see the clinical teams engaged in today's discussions. And I think this is going to be important as we emerge from the pandemic and look towards recovery. But we also talk in the NHS in Wales about compassionate leadership. And for me, that means about inspiring and actually linking with both our staff and our communities. And I think we can demonstrate that this is a shared agenda with climate change, because we need to reduce emissions across the NHS estate by 16% by 2050 and by 34% by 2030. Procurement is the heaviest creator of emissions and the one that we will really need to turn our attention to. And while COVID-19 has meant that we have benefited in respect of reducing travel for staff and patients, and with greater use of technology, reducing emissions, and the need for, however, increased PPE, most single-use, often purchased from abroad, however, again, speaking honestly, will mean that that has had a detrimental impact. But I've been really pleasantly surprised to see in a number of evaluations about schemes that have worked during the pandemic response, actually evaluations taking place that actually demonstrate the impact that they have had on reducing transport and mileage for both staff and patients, and actually reducing the carbon footprint as well. And I'm struck that that has felt quite different from where we were a number of years ago to see that come through so strongly in evaluations. But we do need to be able to ensure we are procuring sustainably where possible, and we understand the consequences of our decisions. So to help your context for today and to perhaps summarise our outlook, the Welsh Government, as I hope you'll be very aware, is deeply committed to the climate change agenda. The First Minister has been clear that it is at the heart of the new government's agenda, and for the first time we have a Minister and a Deputy Minister for climate change with a responsibility for meeting the emission reduction targets and the carbon budget set for Wales. The new All Wales delivery plan to ensure we can reach those targets and our commitment to a carbon zero Wales by 2050 is being developed, and it will be the Welsh Government offer at the conference taking place later in the autumn. The NHS Wales decarbonisation strategic delivery plan is a key element in that Welsh plan, and it's a real opportunity to showcase some of the achievements and, of course, the real potential for us to make a difference in the NHS in Wales. So I want to set us all a challenge, and that challenge is to act now, whether we are staff, whether we are leading organisations, whether we are reaching out to our partners, or whether indeed we are working with our communities. And that means that we must collectively acknowledge the urgency, the need for collaboration, and the ongoing action to address climate change as a common cause, fully engage with the NHS Wales decarbonisation strategic delivery plan and support the climate emergency, recognise the level of change that's going to be necessary as we come out of the pandemic response, which will be a trigger, I think, for us all to act differently, show personal leadership and really be a catalyst for all to engage and act. But I think also to be ambitious for what Wales can represent, and in particular for what the NHS can bring to the table to make a difference. And I'm really delighted today with your kind invitation to be alongside you in our expectations and efforts. And I will wait to see the reflections and the commitments from the day, and hopefully to reassure you that we understand the importance of the NHS acting alongside you and the outcomes for today as well. So thank you very much for listening to me. It's a pleasure to be with you all. And just to finish off by saying good luck, pob luck.
Thank you so much, Dr. Goodall. Thank you for discussing the ambitious targets of Welsh Government, including those futuristic technologies we're always looking at, but also the innovation and recognising the value of simple waste reduction strategies by looking closely at what we already do, which, as you stated, reported in the recently published NHS Wales Strategic Delivery Plan. And I do agree wholeheartedly, we must act differently to build a recovery programme that incorporates what could be also known as the greening of the clinical gaze to continue working towards that 10-year plan for a healthier Wales. And it is great, Wales is at the forefront, and I don't think we appreciate that enough, so we must keep moving forward. I'd now like to introduce our second keynote speaker, Sophie Howe, Future Generations Commissioner for Wales, with a remit set out in law to be the guardian of the interests of future generations in Wales. Sophie Howe is the world's only Future Generations Commissioner. The Commissioner's role is to provide advice to the government and other public bodies in Wales on delivering social, economic, environmental and cultural wellbeing for current and future generations, as stipulated in the Wellbeing of Future Generations Act 2015. Sophie has secured interventions around transport planning, education reform and government policy related to climate change, and these fundamental changes ensure decisions taken today are fit for the future. Commissioner, welcome and over to you.
Diolch yn fawr iawn, a bore da pawb. Thank you very much for inviting me to what I feel is a really kind of exciting moment where we're seeing that connection between what our healthcare system are doing and in our environment, our natural world and our requirements around decarbonisation. And I think that that's been quite a long time coming. And I think much of what is being achieved now is down to, as Andrew said, some of the, the dedicated individuals who are sometimes doing things in spite of the system, instead of because of the system, despite the targets, despite the strategies that we have. Can we really say that tackling the environment is of key concern and is a key priority to our healthcare system? Is it something that we're monitored on? Is it something that the health minister is holding chief execs and chairs to account on? And that's the progress that we need to make, because somewhere in here is the UK's healthcare system. If globally healthcare was a country, it would be the 5th biggest emitter in the world, and that's made up of carbon emissions from procurement, from transport, the use of single-use plastic, and so on and so on. So somewhere in here is our healthcare system. So that 5th biggest emitter makes it absolutely critical that health is one of the key sectors in Wales where we're focusing our decarbonisation efforts. Because really, if we're used to, particularly now, to talking about public health emergencies, but do we have the right sort of concept of that in mind? Because I would say that the 250,000 additional deaths per year from climate change, that's a public health emergency. And are we treating it as such? I would say the fact that the United Nations are saying we're losing the little things that run the world, and the decrease in our ecological resilience in terms of our nature crisis, I would say that that's also a public health crisis. And yet it's the sort of crisis that we're not really doing enough about. And I think what's quite interesting, again, the connection between these things that are going on in our planet and the mental health, the concern, the anxiety raising in our future generations in particular. The anxiety that, as Greta Thunberg calls out global leaders, we are not doing enough to secure their futures. I think, if we look at kind of COVID-19 and some of the narrative and the things that have been exposed there, I think we have to sort of question whether we have been willfully blind. In terms of futures thinking, there's a terminology which is used around black swans. So the things that are kind of really hard to predict. You can't, as much futures planning or future scenarios and so on that you may consider. They're things that sort of hit you by surprise and have a game-changing kind of lasting impact. And then the pink flamingos, so the kind of things that we knew about, if you like, but we probably haven't acted upon. So the known knowns. And in terms of COVID, you will, if you followed the Dominic Cummings evidence sessions, you will have seen, no doubt, this quote. This is a quote. I'm very sorry, Kelechi, to put you on the same page as Dominic Cummings, and I think the parallels between us being willfully blind, end there. But actually, if you look at what Dominic Cummings said, I've been told for years that there was a plan to deal with this, and actually there was no plan. And Kelechi Nonaham saying, if someone had pulled any of us up in February 2020 and said there's a pandemic coming and who would be hardest hit, we could have predicted who would have been hardest hit with a reasonable degree of accuracy. And so, where are we in terms of climate change? If we look at the global risk registers, I think a global pandemic before the pandemic hit was about number 8 in the global risk register. What is at number 1, 2 and 3? All issues relating to the climate and ecological emergency. And I can see a public inquiry at some point in the future, perhaps held by those who are children now, who are questioning our actions, the actions of their ancestors, perhaps exposing some of these similar quotes as well. Why is addressing the climate emergency and our ecological crisis so important to our health? Well, we know the links between health inequality and the wider sort of determinants of health and life expectancy and so on. So about 35%, the World Health Organization say about 35% of what makes a difference to that health inequality gap is relating to income security. But here I'm quite interested in the 29%. So 29% of what makes a difference to that life expectancy or health inequality gap is our living conditions. So housing deprivation, fuel deprivation, lack of green space, unsafe neighbourhoods, low air quality, overcrowding, food deprivation, all things which are related back to our physical environment, and all things which are set to get worse if we do not take some serious action very, very quickly. But there are ways in which we can be addressing that climate and ecological emergency emergency, whilst also addressing these things. So the right to adequate housing, thinking about 20-minute neighbourhoods in the way that we plan and design our communities so that everywhere is in a walking or cycling or public transport distance. Working in partnership with local housing associations and planners and placemakers around this sense of placemaking, access to nature within 300 metres of your doorstep. In terms of health inequality, we can also see that if you're poor or if you're from a Black, Asian, minority ethnic community, you're far less likely to have access to public open space and nature. You're far more likely to be living in areas of high air pollution. So these issues around inequality are clearly connected both to our healthcare system and to the environmental context and factors for our communities. So we are leading the way, however, here in Wales, at least with our overarching approach to protecting the interests of future generations. So Future Generations Act, we were the first. There is a second in tiny Gibraltar, which pretty much, as legislated for our legislation, pretty much word for word. And if you're following the news, there's a private members bill currently going through the UK Parliament, and the Scottish, the SNP, committed in their manifesto also to have a Future Generations Act. But we are leading the way with this requirement to ensure that we take decisions in a way which meet today's needs without compromising the ability of future generations to meet their own. And here, this interconnected wheel of goals, which again, that interconnection is so critical, because we won't have a prosperous Wales if we don't address the climate emergency, because there are no jobs on a dead planet. We won't have a healthier Wales if we don't address the nature emergency and address those factors around air pollution and so on. We won't have a more equal Wales if we don't address those factors too. So everything here is interconnected. And of course, applying these 5 ways of working described by the minister who took the legislation through was the Common Sense Act, a focus on prevention. So, prevention is better than cure. Are we doing that at the moment in the NHS? About 74% of our entire spend on health is on acute services, only about 6% on prevention. And when you put that in the context of half, an increasing proportion of the whole Welsh Government budget is spent on the healthcare system, it becomes even more important that we're starting to see that shift to an integrated approach to recognising the connections between human and planetary health, thinking about the long-term consequences of the things that we do or don't do, working with others and working with communities, involving communities to find solutions to that. So the big things that we need to do, make the connections between environment and health and put our money where our mouth is. Andrew talked about procurement, but this is really about our whole healthcare system. I've had some really interesting conversations with healthcare colleagues across health boards over the last few months, and some quite radical things being talked about around how could we top slice some of our budget and put that into partnership initiatives, which could be, for example, around us recognising that actually it might be worth our while as a healthcare system investing in the decarbonisation of homes to reduce our carbon emissions, to address fuel poverty, to reduce the demand through poor quality homes on the NHS during winter months. It might be worth our while investing in a robust public transport and active travel system. So focusing on some of the things that are in our new transport strategy, how do we make the links between decarbonising through active travel, but also seeing that as a way to improve public health through getting people fit and active and so on. What about a national nature service? So how can we be connecting the thousands of young people who are currently furloughed or unemployed as a result of COVID into jobs which will help us to enhance, maintain, restore biodiversity, working with communities, perhaps addressing some of those issues around food insecurity, which we're seeing now, and food poverty, and that forward-looking trend in terms of increasing food security. But it's also about the small, and I've seen some brilliant things happening across our NHS. So the health meadows in Cardiff and the Vale Health Board. The health board there could have sold off that land for development. Instead, they've created a meadow. They're using that as a therapeutic approach for their patients. They're engaging communities in local food growing. They're working with this brilliant organisation, Down to Earth, who works with young offenders and those on the edges of the labour market to upskill them in sustainable construction methods. That is a really brilliant example of how we're touching multiple goals just through one decision not to sell off a piece of land and to do something better instead. Swansea UHB working with the National Botanic Gardens to deliver 40 community developed green infrastructure projects. So recognising the power of the estate that we have in the NHS, and why shouldn't we be cleaning and greening that estate and using that estate to restore nature. The Ysbyty Gwyned's Green Group, so clinicians focusing on right throughout the health board, how can we reduce our carbon emissions? How can we do better things? Doctors in Cardiff prescribing bikes to patients instead of issuing prescriptions for statins or antidepressants and so on. So there's a huge amount that we can do. And this is the reason why, because if we look back 50,000 years in the past, there's about 100 billion dead people. There's about 7.7 billion of us living at the moment, but 50,000 years into the future, we'll see 6.75 trillion unborn generations. And it's absolutely not our right to use this planet, our world, for ourselves, but it is, of course, our responsibility to maintain the planet and our world for these future generations to come. Thank you. Diolch yn fawr.
Thank you so much, Commissioner, for discussing integration, no longer working in silos, and how the Act gives us the ambition, permission and legal obligation to improve our social, cultural, environmental and economical well-being in Wales. And I'm very pleased to hear that others are picking up the baton. If you haven't heard of this piece of legislation, which I'm really hoping isn't the case, please do look it up online and use it to your advantage. And I think you said something really interesting is, do we have the right concept of a public health emergency? I'm not sure we do, because reports in the media are celebrating heat waves this week. And considering this is the hottest year on record, or at least could be, it could also be the coldest summer we see from now on. And if that's not a public health emergency, then I don't know what is. So yes, some great questions popping up. Please keep submitting them. Thank you so much, Commissioner. Our next speaker is Professor Hugh Montgomery, Professor of Intensive Care and Director of the Centre for Human Health and Performance. Having published over 450 scientific articles, he was the first to discover a gene for human fitness, as well as researching environmental stressors in the exploration of human pathophysiology. He's passionate about the environmental impacts on health and climate change, and states that climate change is a medical emergency. It thus demands an emergency response using the technologies available right now. Professor Montgomery, welcome, and over to you.
Thank you very much for having me, and I will talk. In fact, I have to compliment Sophie on the most fantastic talk, and I'm sure we should do a double act again, because she's laid the case for action very well, which I hope to reinforce. The conclusions of the first Lancet Commission in 2009, of which I was part, have been well quoted, that climate change is the greatest threat to health of the 21st century. Hard to think that that's the case given a COVID pandemic, but it absolutely remains true. And I'd like to just give you the scale of impact and why. Because we think we've been living in the world of using fossil fuels forever, but we haven't. The first commercial oil well was only drilled a little over 160 years ago, 67 feet deep, and without much commercial use. Because remember that 105, 110 years ago, most of the lighting in New York still came from whale oil and lard. The first Edison light bulb with a filament only appeared around 140 years ago. And around 120 years ago, there were only around 8,000 licensed motor vehicles in the whole of the United States, which basically means the world at that time. The first air conditioning unit was only developed around 90 years ago. The first commercial jet ticket was sold about 10 years before I was born. Before that, no one could fly commercially. And the first modern day plastic bottle, oddly enough, was only produced in 1973 when I was 11. And the first smartphone only appeared around 20 years ago. So this is all recent history, but look at how things have changed. From the first Edison bulb appearing only 140 years ago, we now sell 380 light bulbs a second, or 12 billion a year. From 8,000 licensed motor vehicles on the planet in 1900, we now sell 8,000 worldwide every 45 seconds, with 1.4 billion in use. from no one at all using aircon in 1929, so less than 100 years ago. We now sell an air conditioning unit every 6 seconds with 1.9 billion in current use. No one was flying in a jet plane 10 years before I was born commercially, but just before COVID hit, there were 142 people boarding every single second. When I was 11, no one was using a plastic bottle. We now use or sell over 15,000 a second. And from no smartphones 20 years ago, we're now selling 47 a second. All of these take a massive amount of energy to make and a massive amount of energy to use. And they derive that energy largely from the use of fossil fuels. And this, in the year before COVID, was what we were burning worldwide. And as we'll come to later on, COVID really hasn't made a dent in that at all. We're putting a huge amount of greenhouse gas from that combustion into a very small atmosphere. This is the atmosphere of the Earth rolled up into a sphere at standard temperature and pressure. You'll see there really isn't very much of it at all. And if you put a lot of greenhouse gas very quickly into a small volume, the concentration will go up. This being the historical record over the last 800,000 years, with natural oscillation for sure. But look what's happened in the last 50 years. We have gone up at a rate that is absolutely unprecedented and to levels that are also unprecedented in recent geological history. Indeed, look at the rate of change. I prepared this slide first for May 2018, when we had 412 parts per million of CO2 in our atmosphere. That was May 2018. In May 2021, we were already up to 419 parts per million. This rate of inexorable rise is no way diminishing at all. And these greenhouse gases let through shortwave radiation and trap longwave radiation. That's why they're called greenhouse gases. And they're trapping the energy equivalent of around 5 Hiroshima bombs a second. And over recent history, 90% of that energy has been stored in the sea. So whilst you hear rather benign sounding talks like, well, we've only gone up by 1 and a bit degrees, 1.2 degrees of surface global average temperature, firstly, think how much energy it's taken to heat the entire world's atmosphere by that much. And then think that 9 times as much of that energy has been stored in our oceans. If you add energy to an atmosphere, you get weather. If we didn't have energy in our atmosphere, there would be no weather at all. The more you add, the more weather you'll get, and the more extreme weather events you'll see. These data were carbon brief showing recent history extreme weather events and their proven statistical association in orange with climate change. And you'll see that the bulk of these events are indeed being driven by us. Let's just think about some of those. The summer or the winter months in our hemisphere just before COVID. And this is what happened to Australia. And we know that these sorts of wildfires there are indeed statistically being driven by climate change. But it's not just there. This is Siberia, where we have these fires that are now burning through peat and tundra, many of them underground, in fact, therefore they won't ever go out, releasing colossal amounts more carbon dioxide. Also melting methane hydrates, 84 times as powerful a greenhouse gas as carbon dioxide over a 20-year period. Huge areas, not just Siberia. This is the Amazon, which we all know about. The Amazon itself is drying out, which means that fires readily burn, especially if ignited by humans to clear forest. And as you get these thermal lifts at the leading edge of the fires, that leads to lightning at those leading edges, which propagates the fires further downwind. But it's not just the Amazon, it's Angola and Africa. It's Indonesia. It's California. And it's not just fires, of course. We could be talking about cyclones. We could be talking about floods and excessive rainfall. We are seeing this exponential rise in extreme weather events and their severity all around the globe. Now, I haven't got time to discuss in every detail every impact of climate change on health, so this slide will have to serve as a proxy to canter through them. But essentially, we get a longer spring pollen season, greater pollen densities and greater allergenicities, increased ground level ozone, and also fires coming from these heat waves that we've talked about, all causing respiratory disease. And with the heat waves and particulates, and many of these as well, driving cardiovascular disease. You'll see the mental health impacts being referred to on the top right. The extreme weather events like heat waves, high rainfall, rising sea levels cause drought, flooding, reduced physical work capacity, and combine with ecosystem collapse to lead to loss of crops, consequently stunting and starvation. We have algal blooms, flooding leading to chemical poisoning together. We have increased bacterial diseases and diarrheal diseases from rising temperatures. We have vector-borne diseases such as dengue, malaria, and schistosomiasis spreading rapidly because the conditions for the vectors themselves have improved, so the vectors can breed more effectively in larger areas, but the parasites themselves replicate more quickly, and the vectors themselves feed more often, meaning transmission rises. Together with poverty, loss of habitation, and starvation, we get mass migration. And if you get mass migration into poorer areas already resource-starved, you get conflict. And we've already seen that too. Indeed, we were warned of this as long ago as 2003 by the Pentagon, no less, who talked about the impacts of climate change potentially being a significant drop in the human carrying capacity of the Earth's environment. So what they're referring to here is billions of people dying. We have seen those conflicts. This was the impact of the Kazakhstan heat wave in 2010, which led to Kazakhstan becoming a net importer of grain, not an exporter. That drove up the price of wheat on the international markets from $150 to over $350 a metric ton. And whilst we were buffered from that by supermarkets in the West, in many areas of the world, people had to pay that price. When they couldn't afford to, there was uprising. And whilst there were many reasons for the Arab Spring bubbling under for political tension, the trigger is recognised to have been this rise. And downstream of that, of course, we end up with mass migration into Syrian cities, contributing substantially to destabilisation of the Syrian economy and body politic, mass migration into Europe, and the cascading impacts, which are long and far-reaching into European politics, even as far as Brexit. Things will get worse. We know that we have sea level rise now of 5 millimeters a year, but that's now unlikely to be where we stop. Jim Hansen in America is commenting from more recent analyses that we could be looking for a sudden uptick in sea level rise, measured in tens of meters in coming decades. And indeed, even at the current rate of sea level rise, many, many people are vulnerable. As this paper in Nature Communications showed, 1/3 billion people will be underwater in not terribly long. 640, that's basically 2/3 of a billion people, similarly at risk as sea levels rise. Of course, people don't wait until they're underwater to migrate and move. They'll leave long before that, before the high tide mark has covered them up. And furthermore, of course, as water ingresses, it erodes and the land drops its height towards the sea. So things are going to get bad very quickly indeed. We know that this has been recognised a long time ago, even the Indian government in 2006 recognising the impacts on mass migration and potential conflict and building a 2,500 mile long fence, actually 7 meters high, double thickness razor wire and steel along the entire border with Bangladesh to keep climate migrants out. The danger now is that we've been talking far too long. Many of the speakers on this call have been in this game for over 20 years, and we have seen nothing but nothing change. That graph I showed you of CO2 rising has not in any way slowed. We are indeed on the worst case scenario track that was predicted by the UNFCCC. That's RCP 8.5, taking us to radiator forcing of 8.5 watts per square meter of the entire Earth's surface continuously by the end of this century. That takes us to a high risk of above 4.5 degrees temperature rise. And just see what we've seen with 1 and a bit degrees. Worse than that, last week on the 18th, a paper was published by the North American Oceanographic and Atmospheric Administration and NASA, showing that we've now tipped into positive feedback loops. We've lost too much ice. We're not reflecting light back into the atmosphere. That's leaving dark ocean and dark land to absorb more. And we're adding greenhouse gases, meaning that the rate of energy gain has now doubled in only 14 years. Remember, that's not going to reverse if we stop emitting greenhouse gases even now. That's on top of a mass extinction event, which has seen us lose 70% of vertebrates on the planet since I was age 10, and we're losing 8 species now. Some quick comments then on where we are at the moment. A caveat, what does net zero mean? Well, an editorial in Nature 6 weeks ago made very clear that it means nothing at all. People use this term net zero, and it doesn't mean anything. You're in fact allowed to take a photograph of a forest and 5 years later show that you haven't chopped it down, and you're allowed to offset your carbon emissions against the fact that the forest hasn't been chopped down. That doesn't mean that you reduce CO2 emissions at all. It just means you've not contributed further by chopping down trees. We actually need to be reducing the CO2 and greenhouse gas emissions to our atmosphere. And until a week ago, the data was saying, to give ourselves a 50-50 chance, we need to be reducing 8% this year, which we haven't, and last year, which we haven't, and every year from now on. But given that we've now entered a period of positive feedback, that, in my view, will be far too slow. We need to be vastly more aggressive than that. Now, those data wouldn't have been considered by the UNFCCC, and in fact, their report is due out next year, but the scientific report, which has yet to be politically filtered, was leaked to the press last week. And let me just let you read what the world scientists are saying. So Sophie is right. This is about intergenerational justice. This is no longer about us protecting the planet for generations to come. This is about us taking action now to save our own lives, those of our patients and those of our children. And if we don't, the outcome is going to be very grim. So this is a call to arms and a call to action. And with that, I shall stop and hand back to our chair. Thank you.
Thank you so much, Professor, for discussing the exponential industrial and technological growth that has occurred in the fraction of time of our Earth's history relative to its existence, and what that has caused for our planet. The science and evidence of climate change from the global perspective may seem far removed from the local environment, but as you described, these issues are not distanced from us. We are a global community, demonstrated by our own healthcare system's complex and developed relationship with the climate crisis. So very interesting. Thank you so much, Professor. So I'd now like to introduce Dr. Frances Mortimer, Medical Director at the Centre for Sustainable Healthcare. She has led the development of their sustainable specialty programmes, identified the 4 principles of sustainable clinical practice, and created the SUS-QI framework for integrating sustainability within quality improvement. And she states the scale and urgency of carbon cuts needed to protect from climate change dwarf the financial challenge currently faced by the NHS. And to meet the UK's carbon reduction targets, the health sector will need to go well beyond simple efficiency to strip out redundant process and create whole systems change. Dr. Mortimer, welcome, and over to you. Thank you.
Thank you very much, Amarantha, and thank you, everybody. I was asked by Amarantha and the Green Health Wales team to talk not so much about the content of our work at the centre, but about my journey and how I found it. Because when I first started on this trail, it was about 13 years ago, and I was a junior doctor. I just started specialising in kidney medicine, got onto a training programme in London, and I decided to step out, and I'm increasingly meeting other people who are in that moment in their lives now, who are approaching us. Why did I step out of medicine? I think, I don't know that I had the understanding that Hugh has just shared with us of what the true extent of the climate crisis, but I was definitely aware that we were in a very, very terrible situation, and just the dissonance between that and what I was encountering at work, where all our focus was on trying to help individuals and their families and restoring them to their lives and what we saw as health. When I also understood that society as at large was, completely threatened and not healthy at all. I just felt that I couldn't see a way of addressing that challenge while remaining in healthcare. But one of the things that I hope that will come out through this brief talk is just that by the work that I and others have done, I hope that that's not the case for you, for many of the people on this call, that actually there are huge opportunities to stay and use your roles within the system to drive a wider cultural change and very specific practical change to transform our healthcare system and make it environmentally accountable. So back in 2008, when I joined a tiny organisation called, which became called the Centre for Sustainable Healthcare, Some of the challenges we faced were that sustainable healthcare itself didn't really exist as such. It hadn't been defined. Work that had been going on to date was focused a bit on estates and facilities management, which is of course very important for sustainability, but didn't really have any place for someone from the clinical side. Also, there was much less wider awareness of the nature of the crisis that we're in and the urgency of tackling it. And that is one thing that gives me hope over the last 2 years is the huge awakening across society. And that's translating into the goals that are being set for decarbonisation in the public sector and in the NHS. But some of the opportunities were that actually the Climate Change Act of 2008 had just been passed. So there was a kind of political awakening. So there was some support at that level. And also I was very privileged to be connected with some wonderful people, thinkers and communicators, including Hugh and David Pencheon, who's here today, and others, Muir Gray, a wonderful systems thinker and a public health specialist. And of course, we did have a chance to work together to shape the field. One of the things I wanted to do from the start was to have that clinical focus and help to translate sustainability for clinicians and think about how can I practice sustainably? What would that even look like? And that's where I came up with these principles of sustainable clinical practice that you may have thought about, which are things about like prevention, empowering patients in their own care, lean systems, so stripping out waste, and low carbon alternatives, so understanding the different carbon footprints of things like inhalers, that you have a choice of something that is 20 times or more less carbon polluting, then we should be using that. And also working in education to kind of think about how we craft a professional identity where our health professionals that are coming through training are aware of the relationship between the environment and health and their role in changing the healthcare system and how to go about that. And one of the things that you may have come across that I found very powerful is linking to healthcare improvement, or sometimes called quality improvement, because that is a time within the role of a healthcare professional where your focus is on improving the system. And so if we can build sustainability into that, then we're equipping people with the tools to take those changes through into practice. I think we also worked in a sort of systems way, thinking about engaging with clinical specialties and the multi-professional communities and that are around those. So whether that's anaesthetics or kidney care, we did lots of early work in psychiatry and mental health. And of course, the patients themselves are very important, and industry, and it allows you to facilitate lots of changing thinking and action within a sort of smaller cosmos that can then feed and learn from each other and make more of a whole systems change. I mean, one of the very big challenges we've faced is because of the low priority given to sustainability, there has not been the investment in the research that's needed to understand where the carbon footprints are, carbon hotspots are, and what the different available options are, how we can achieve what I think should be the core mission of healthcare, which is to provide health for people at the lowest possible environmental, social and financial cost, which is what we call sustainable value. So that when we are running a service, we're measuring that. When we're doing a quality improvement initiative, we are constantly measuring ourselves against that. When a new product, if say it was a new piece of PPE was being developed, people are thinking, well, we need to protect health. It needs to be effective in preventing the spread of transmission, but it needs to be environmentally the leanest possible option. It needs obviously to be affordable. And the social aspect would be, things like how does it impact on communication and staff well-being and so forth. So those things should be core to the way that healthcare is practiced and managed. And investment needs to go in to the research that would underpin that. I guess it's been obvious absolutely from the start, and I think it's obvious from the talk that Hugh has just given, that there is no one body, person, framework, or any form of intervention that is big enough to tackle the crisis that we're in. And so I think all along, all of our approaches and efforts have been to try and find ways to empower other people, like everybody on this call, within the system, to recognise that it's within their role, it is their professional duty, it's within the culture, it's encouraged, it's permitted, and you're equipped and empowered to make the changes that need to happen. And I would not be able to work out what all those changes are, but I hope that through the way that we all work together, we can create a new lens, like a greening of the medical gaze, and a new way of thinking about things, and that allows other people to see what changes could be made within their own domains. One of the ways that we can support that is by creating training, but also roles within organisations. And I've helped to initiate some of the roles that are out there now, but there are lots more, which is wonderful, of fellowships or scholarships where different people are given a particular remit to develop sustainability within their context. And I think that's hugely valuable. So just in summary, I think it's vital that sustainability is seen as core to the mission of healthcare, that it's a core driver, it's part of our professional identity, and I hope that because of the work that I and other people have done, everybody else doesn't need to step outside of medicine necessarily to make a difference. They can take it right into their core professional role and change the system from the inside. And of course, healthcare itself is hugely powerful within our culture and can lead the way and accelerate change in wider society. Thank you, Amarantha.
Thank you so much, Frances, for sharing your very personal journey into the subject of sustainable healthcare, taking, I can imagine, what must have been a very nerve-wracking leap away from the entrenched, structured training pathway to build that bridge on behalf of us who have come after you between sustainability and clinical work, and how you've developed and established this really diverse and collaborative network with the Centre for Sustainable Healthcare to share your research and practice in this field. So thank you so much for sharing that with us and for mentoring me this year. Our next speaker is Professor David Pencheon, Founding Director of the NHS Sustainable Development Unit, now known as the Greener NHS, which develops organisations, people, tools and policy to help NHS England fulfil its potential as a leading sustainable and low carbon organisation. Professor Pencheon was the winner of 2020's the BMJ Outstanding Contribution to Health Award, and he has been a world leader of efforts to tackle the climate emergency within healthcare. Professor Pencheon, thank you, welcome, and over to you.
Thanks very much, Amarantha. So I'll be very quick because there are lots of really fantastic questions coming in. It'd be much more fun listening to them than listening to me. I just want to say just a very few words about the role of Wales, because it was always struck me that Wales has a very particular opportunity. And we all have opportunities, we all have leadership roles. The best advice I can give on the basis of the evidence is don't do nothing. Just don't do nothing. But by doing nothing, by just worrying and doing nothing, you're complicit with our sleepwalking into a nightmare. So I just want to say basically 4 things about why Wales is particularly important to this. Firstly, if you live in Wales, you live in a country which is of a perfect size to see national, legal, social, economic, political change. It's small, 3 million population. You can be nimble, you can be reactive. There's a very small chain between you and people like Andrew Goodall and the ministers and what have you. So you really do have the opportunity to change. You have much better access to formal leaderships. We're all leaders, but formal leaders are very important too. So really make the case. And my best possible advice in order to engage formal leaders is to find them saying something right and ask them how you can help. Ask your formal leaders how you can help. Don't but necessarily berate them or criticize them or diss them. Ask how you can help. The second reason why Wales is important in this global journey is the politics of Wales has got a very rich heritage of social justice. And you've got to remember, you've heard from people like Hugh and others and Sophie that, for instance, the richest 1% of the globe produce more than twice as much carbon as the poorest 50%. This is completely unjust on anybody's moral compass. So, and Wales has got a very, very proud heritage of social justice. Some of you will remember when Desmond Tutu visited, that I think he said something like, Wales is small as a country, but has got a kick like a mule. And in this year of COP26, you need to use your mulish kick big time. The third reason is the legal framework, and Sophie, Howe and Jane Davison have done so much work on embedding the social desire for change within the legal framework. And you've got to remember what legal frameworks do. It legitimizes us in the health and care sector to make sustainability a duty of care, to make it a dimension of quality. So intergenerational justice is a very, very important part of the legal framework that Wales truly is a global leader. And when you have legally binding targets like 37% by 2025, as Andrew said, you have got to hold yourselves and others to account on that in the most friendly, positive, assertive ways. Get mad, stay mad, but don't get mad at your direct neighbors. The last reason is that this is about people. This is a people journey. We can talk about as much technology and as much data as you want, but this is about people. And that's why Francis's words on her personal journey is very, very important. Every one of us has got to have that most important conversation with ourselves about what is our role, what is our added value, where are we going to contribute to what we have a social duty to do, which is to leave the earth in a better place than we found it. And currently we are breaking that long-held social contract over hundreds and thousands of years to improve things. We are leaving the world in a worse place. So just remember, this is not about Wales, this is about the people of Wales, understanding your personal and professional journey and turning urgency into agency. Thank you.
Thank you so much, Professor, for your always powerful words. And to use a phrase used before, Wales is a small, mighty, nimble nation with the capability to make real progress on this vast and wide-reaching topic. And the power that each individual has with those metaphorical mulish kicks, a phrase I've never actually used before, to contribute to the collective movement, which looks to transform both our Welsh healthcare system and, as we keep saying, show the rest of the world how to do it, because I think we're underestimating what we are achieving. So thank you so much, Professor. Our final esteemed speaker of session 1 is Helen Howson, Director of the Bevan Commission, Wales's leading health and care think tank. She has played a leading role in establishing the Commission, in developing prudent healthcare, the Bevan Innovators and Bevan Academy. She has previously worked as a public health consultant with Public Health Wales, held a number of senior positions within Welsh Government health policy and strategy, and has been an advisor with the World Health Organization. Helen, welcome, and over to you. Thank you.
Many thanks for the invitation. Absolutely delighted to contextualise this in Wales, and on behalf of the Bevan Commission to set it in the context of that wider, if you like, definition of sustainability. We talk about sustainability in two contexts. One, the sustainability of the health and care system itself in moving forward, but also the sustainability of the whole context of the environment within which that sits. And as David says, we're actually a very proud nation. We've got some amazing leaders that actually set us up and set, if you like, an example for the rest of the world. And Bevan set up the NHS at a time when everybody thought it was impossible, just 2 years after the World War. Now, what Bevan had was that passionate commitment and that belief. And I believe Wales has got that, and it's got an awful lot passion and to show the rest of the world. I think it's also important to note the quote that he identified really. It didn't spring from one person or a team of experts. Actually, the model was rooted in the realities of local communities. And I'd like to just unpack a little bit more around that and the context within which we see change and transformation happening in Wales as we move on, particularly from COVID. But how do we make both the health and the care system sustainable and relevant for the future at a time where we've seen, huge issues around COVID and we're almost, there are so many priorities. We're trying to understand which one is going to come top of the list next. We've always argued as a commission that you need to think really radically and outside the box if we're ever going to change things in a way that we need to do. And at a pace that we need to. We've always said that actually it's no point in just being a think tank. It's no point in just having some great ideas if you can't translate those ideas into practice. And some time ago, we made the decision that we weren't just going to be a think tank that was just going to produce papers, important as they are. Actually, we're going to help translate that into action and change things. And we came up at the time, in fact, it was at the time of austerity, with the concept of prudent health and care. And that was designed and it was developed with all of our commissioners. We have 24 commissioners that we draw on. They give their time and expertise. And at that time, we came up with this real need to understand things from a very different perspective. We looked outside, we looked from different lenses and through different lenses. And we came up with this really, which was really important. And it wasn't just about the health and care system. This is about people and about all sorts of ways in which we work differently. I'd like to just remind you of prudent healthcare, which underpins Welsh health policy now, and very clearly sets the context, and even more so in light of the COVID. Some of you may have seen Don Berwick, who is one of our commissioners, recent blog really around the relevance or the increased significance of those principles. I'm going to remind you of them because they have an incredible alignment with the agenda that we're talking about here today. It is very prudent to retain and maintain health. And we've heard it, we've heard it today. I think it was Sophie reminded us that over 70% of the health care budget is spent just on health care. In other words, on illness, not on health and well-being. So our first principle is really reminding people that health is really important, well-being is important, and also the partnerships that help create that, which many of which, if not most of which, are outside of the NHS and the social care sector. So we need to re-understand that health is created outside. Environments are really fundamental to health, and therefore we need to understand the context within which our principles are working. So we understand the importance of that. The second one, of course, is around those issues around inequalities and making sure that we don't lose sight of the fact that there are some people much better off, whether it's the environment they're living, whether it's the housing they're living, or whether it's the circumstances within which they live, work and play. But we need to understand that whole context within which that sits. And also, and here's the rub, making the best use of all skills and resources. And we asked ourselves as a commission, are we, as a health and care system in Wales, making the best use of all skills and resources? And we clearly weren't. Whether that's the skills of people, whether that's the resources, the pounds, whether it's the equipment, whether it's the drugs, whether it's the assets that we have in and around us, whether it's our staff, whether it's the public or patients, and we weren't. And we fundamentally challenged the significance of that. Principle 4 was really, do we do only what's needed? Do we do more? Do we do harm? And of course, we do all those things. We do much more that's needed. We give people many more drugs than is probably necessary. We do far more interventions than is needed, and we take people into hospital and probably do harm with infections and all sorts of things. We need to understand that doing more isn't necessarily better for people and better for the environment. And we need to really be thinking about what it is that actually can make things different. And we need to ensure that we don't have the variation, whether it's in environments, whether it's in how we use equipment and our resources, but certainly ensuring that where there is good evidence, that is applied consistently and acutely across. So those four fundamental principles are absolutely spot on for the work that we're talking about here around the impact on our environments. If I take it on another stage then, and we say, okay, we've looked at, and I wonder, that question I posed at the outset, I wonder what an Aaron Bevan would make of the healthcare system. I wonder what he would make of the situation and the environment we find ourselves in. But we've become very much medicalized, and we've kind of lost sight of the real power and influence that wider society makes on well-being and on health. We therefore are suggesting that we move away from the more of a traditional model of healthcare, where the power and, if you like, where we deliver care to people as passive recipients, not partners in that care, to actually a much wider social model, which recognizes this shared responsibility of society with the individual. A model where the responsibility of improving health well-being is everyone's responsibility, not just the healthcare system. And in the same way, the environment within which we live. Now, the challenge remains really around how do we ensure that we get that effective rebalancing, that relationship between people and the state in a meaningful and sustainable way, in a way that actually addresses the issues that we're seeing today. The Commission has believed for a long while that it is people who are fundamental to this. Notwithstanding the politics, which David touched on, and David also touched very clearly on the power of people. We probably need both top-down and bottom-up, but certainly what we've recognised is that without people in the system being part of the, if you like, the drive for change, that transformational change that we need to address the challenges that we're seeing today. And no system, however expertly designed, will be sustainable without the commitment of staff and the public. And we ignore that at our peril. So at the Commission, what we recognised was how can we give people greater, if you like, greater visibility, greater opportunity to come forward with their ideas, to try something out, to test something out. We created, therefore, three levels, really. Bevan advocates are people, the public. Bevan Fellows are slightly more senior research focused with a national leadership as well. And our Bevan exemplars are people in the system. And we ask people in the system, have you got an innovative idea? This is not just about improvement. This is about much more radical change. It's giving people the opportunity and the space to try something different, giving them coverage if it goes wrong, giving them the opportunity to try out what their gut reaction tells them probably will work or ought to work. Have you got an innovative idea? We ask them, is it prudent? So does it comply to those basic 4 principles? And can you do it in a year? And that is where we started. We didn't have money, we just had an idea. And that was where we started to say, well, okay, let's see what happens. We're now in our 6th year. Each cohort we've had has been around 40 people, approximately. And they include a whole range of different ideas and things that people wanted to try out and test. I think it's fair to say that we are now looking at a whole different context within which this fits in the sustainability issue. And so we have just issued another call. So for those of you who are interested, please look onto our website. Our call is currently out and very much for sustainable solutions as well as part of that. So if I take you on and give you some just very brief examples of what they are about, include things such as recycling hospital waste, and we've still got an awful long way to go on that. We have seen things. This is Tamsin Cowden's Powys from Powys Teaching Health Board. She's a community nurse and took the message out into her nursing community and into her with her colleagues. And thirdly, and you'll hear more about Tom Downs and his team, about how Tom tried to ensure or tried to make, if you like, his hospital into a green hospital, something whereby they looked at energy, they looked at transport, they looked at food waste, they looked at a whole range of things. And as a group of, dare I say, volunteers, this is over and above their day job, they made significant changes. And I think that's really, really important. This is the power of people. Without people's commitment, energy, enthusiasm, we're not going to get far. We might have the political framework and the, if you like, the context within which to operate. This is about us all taking responsibility, and we've heard that time and again. So it's one thing having these. We've got over 300 different ideas that we've developed and worked with people over the last 30 years and over the last 5 years. What we're now interested in is exploring how do you take these ideas and make them spread? Because it's one thing testing them out in one particular area. We're not very good at taking ideas from other people. Often, you know, we've got a better idea, or I'm doing it, my place is different here. What we've got, so we've been testing out for the last 2 years, how we can ensure that these ideas don't just stay in little areas. What we're looking at is how can they stick across the whole of Wales. Now, essentially, we should be putting our arms out and saying, yes, I'd like to have a bit of that, but we don't like that. And this is about understanding where people are coming from and understanding how we can ensure that the mechanisms and the learning from these individuals can be taken and probably adapted to fit different environments. For years, we've said, here we go, here's a package, this is how you do it, you now must do it, without understanding the context within which that lands in different organisations, in different communities and different settings. And so our work, we've just finished our adopt and spread work for which we've been looking at for the last 2 years. And it's really all our results and our tools and our support mechanisms and information can all be found on our website. I'd like to just close, really. I'm a great David Attenborough fan, and I don't know whether many of you saw one of his last sessions whereby the interviewer asked him, what's the big message you have, having done all this work, having looked at all this? And I sat there, and his big message was, let's not waste, stop waste. And when you look around, what we do without even thinking within our own day jobs, within our health and care systems, we waste an incredible amount of resources. And if there's one thing we can all do as individuals within those settings is make a commitment to stop waste, whether it's medicines, whether it's equipment, whether it's time, whether it's pounds, you know, the resources, whether it's food, whether it's transport, energy, whatever. We can all make a commitment. And as 100,000 people employed in Wales in the health sector, we could make a significant impact by just making that commitment. And perhaps a final slide, just to remind us really that actually Albert Einstein suggests that actually insanity is, of course, doing the same over and over again and expecting different results. We do it all the time. Let's make a commitment today to go away and be brave and bold and courageous, because leaders in this field have to be brave, bold and courageous. We've learned that from our exemplars. They stick their necks above the parapet. They don't always succeed, but they are brave, they are bold, and they're courageous, and they are passionate about doing something different and making a difference. So my challenge to you was, let's all go away and make a commitment to make a better and a greener Wales for the future. Thank you.
Thank you so much, Helen, and for encouraging what must be rapid, radical actions, incorporating the principles of prudent healthcare, principles which do complement those of sustainable healthcare, and for highlighting how the Bevan Commission does offer support for innovative ideas to help drive this vital agenda. Our Workshop B attendees will benefit from this this afternoon, but please do head over to the Bevan Commission website to investigate the plethora of resources, courses and support that is on offer. I'm going to hand over to my educational supervisor, Dr. Fiona Brennan, consultant anaesthetist, who will be chairing this Q&A panel. Thank you, Fiona. Yes.
Thank you, Amarantha, and thank you very much to all our speakers for joining us today and staying for this Q&A session. So yes, my name is Fiona Brennan. I'm a consultant anaesthetist in Cardiff. I supervise Amarantha's fellowship in sustainable healthcare, which is linked with Health Education Improvement Wales and the Centre for Sustainable Healthcare. And I started my sort of decarbonisation journey in anaesthesia back in September 2018, which you'll hear a bit about more in session 2. And then we sort of formed a Welsh environmental anaesthetic network, and then we've gone on to hopefully grow this Green Health Wales network. We'll move on to the Q&A, and I'll just, before I do that, just point out that our website is up and running. It's still in evolution, but there's a really lovely learn section, which if you could all just take a little look at later on today, that would be great. So I'll do my best to direct some questions. So I'm going to start with one, probably to Sophie Howe, but please fight amongst yourselves to answer it. It's from a Dr. D. Gray. She works for the Royal Society for Arts Royal Society for Arts. Her work involves making distinct connections between human and planetary well-being, encouraging people to incorporate both of these in their day-to-day lives. And she'd really like to sort of hear and discuss how they may be able to provide an opportunity to bring the work of Green Health Wales to the RSA Fellows. So I don't know if anyone wants to comment on that.
I'm happy to pick that up. Fortuitously, I actually had a meeting with the Arts and Health lead, Sally Lewis, yesterday. So you know, there's loads of good things going on there. I mean, I think the issue with you know, the Wellbeing of Future Generations Act is that it combines and puts on an equal footing the social, economic, environmental and cultural well-being of Wales. And I think that's so important because we've kind of missed the connections between all of those things. The power of culture and the arts, for example, in both improving people's health, but also as a tool around communicating climate change, the power of creativity in our organisations in terms of doing potentially different things. One thing that I learned yesterday, and it's something that I sort of have been advocating for a long time. I think one of the well, I often say the easiest ways, but nothing is ever easy. But we'll stick with easy. One of the easiest ways to bring about some of the changes that we want to see and those connections is to have mass job swap across the public, private and third sector. So why would we not have conservationists in our NHS planning teams? Back to the arts and health movement, there is I've got this vision of having kind of creatives in residence in all of our public sector organisations, and there's something that we're working with government along those lines. But in Swansea Bay, there are already 5 creatives in residence, one in the capital planning team, one in mental health, one in primary care, one in patient experience, and I can't remember where the other one is. But imagine if we combined those creative in residence with conservationists in residence, and the different type of things that you would then see happening in our public sector, where, you know, in many completely understandable ways, we get trained, you know, from the beginning of our careers to look through the silo of our own profession. And well, it's not even the beginning of our careers, it's actually built into the education system, which, you know, curriculum reform is probably something that we haven't got time for today. But there is something about that kind of holistic thinking, exposing yourself and going out of your way to expose yourself to unusual suspects and bring their ideas and so on board. It's one of the reasons I love the Bevan Commission, because that's exactly the sort of thing that they are doing, and we need hugely more of that if we're going to see those connections between how can I improve planetary health whilst also addressing food poverty, which has a massive impact on the patient in front of me, as one example.
Definitely. Thank you, Sophie. And sort of while we're on that topic, again, just thank you so much to the audience for engaging and supplying us with so many questions. It's quite hard to keep track. But it was from Andy Middleton. He said, who are the players not at the table today? Farmers, restaurateurs, retailers, hospitality, outdoor sector, etc., whose skills, services, products and networks are vital to creating systems change. So, and then Iona Hughes, have the NHS connected with area statements process in Wales, and how can that improve collaborative approach? Quite a lot of questions coming in from much more sort of, I suppose, that concept of radical collaboration across sectors that we've never engaged with before, which is really encouraging. And yeah, how can we organise to all get together and try and sort of, you know, actually act on this interest?
Shall I have a go at answering that, Fiona?
Thank you.
Yeah, well, I think this issue of who's not at the table is very important. But rather than casting our accusations wider than the health and care sector, I think it's how the health and care sector play their role, actually. It's incredibly important. I mean, bar a few notable exceptions like Hugh and Francis and quite a lot of other people, the healthcare system is still notably quiet. We like to think that we're leaders in this, but I don't think we are. And I think if we look back on the evidence of the tobacco story, it was not until doctors and nurses and healthcare managers stood up and stopped smoking and made it communicated the issues that Hugh and Francis did in terms of very emotive but factually based methods, that people really stood up and took notice. I think is in the healthcare profession, we forget how rather dangerously trusted we are. We are still amongst the top nurses of the top, or Ipsos Mori will always have nurses and doctors and professors and scientists and teachers at the top of their role. Unless we frame climate change as a health issue, unless we address it as part of our duty of care, just in the healthcare system, that is incredibly important. And we do it visibly. I mean, I think one of the speakers talked about the social value that the healthcare system, we are massive employers, we are massively public, we're anchor organizations, we're huge procurers, we're huge partners. If we do not visibly sit up, stand up and speak up about our role and our duty of care about present and future generations, then that is an abrogation of our responsibility and our duty of care. So we should look to ourselves.
Thank you. So sort of moving on from that, it leads nicely into another question, which probably maybe Dr. Francis Mortimer could answer. It says, what is the easiest way for people to request a change or addition in the curriculum, either undergraduate or postgraduate training, to get sustainability on the agenda so that it's engaging all of us to push these boundaries further and make these connections?
Well, I'm not sure about the easiest way, but the ultimate goal is that it should be a spiral curriculum, I think people may come across, but so that it's integrated across the whole curriculum, because there is nothing that it doesn't connect to. And in terms of how to get there and the steps on the way, I think a couple of things. One is that for undergraduate medical curriculum, it is helpful that the GMC now references sustainable healthcare as being an outcome for graduates since their 2018 requirement. So that's a hook that has massively increased the engagement at senior levels in medical schools. And the other thing that's happened is that medical students themselves have organised internationally and across the UK and have brought out the Planetary Health Report Card and are ranking their curriculum and their courses for how much teaching they're getting on this important subject. So I think those hooks are really important. I think that taking the where it fits in the curriculum, I mean, there's obviously a natural fit between public health or global health and planetary health, but one of the problems with that is that public health in the curriculum itself doesn't always get the most sort of respect and time and attention that it needs. So it is really important to integrate into clinical teaching, and I think quality improvement is an area that medical schools are having to introduce now, and also nursing and other health profession courses. So it's very and because it's quite new to them, SUSQI, sustainable QI, is a really good way in there. But also there are clinicians in pretty much every area who do get it, who are trying to make changes. And if you can reach out to those people and get them involved in leading session, perhaps as students come through that their cardiovascular block or whatever it is, so that they are led by clinicians and the relevance to clinical care is made clear. I think that is really important. Actually, anaesthetists are really great for that. There's lots of them and lots of knowledge and lots of very specific changes that they can teach about.
You're on mute, Fiona.
You're on mute.
Not sure how I managed that, but thank you. So this question is probably for, thank you, Frances, probably for Professor Hugh Montgomery. Says the candidate, the question is, I'd be interested in hearing from the panelists as to how they are engaging their supply chains and wider ecosystem to help meet their sustainability ambitions.
It's a very good point, actually. I've made some quick notes there on the questions that have been asked so far, and so I'll just pick up quickly on those, that who's not at the table. We do have to work with other people, and quickly. We can't just stand there and shout that something's got to be done. And that means working with the companies that are actually actively making a change. I think it's beyond the case now of trying to persuade the bad companies to do something right. We've got to work with the good people. And there is a lot of that activity, and you can seek them out. So declaration of interest, I do consult for AstraZeneca, but they are making absolutely colossal change. And if we start working with the companies, for instance, that want to move to dry powder inhalers from fluorocarbon propellants in inhalers and go looking for the lowest carbon footprints, that will help a lot. And we need to work with our hospitals on the issues of contracts, as has just been mentioned. This is probably the quickest win. If we put in to say, the contract is to deliver this service and that's what we need, but the next line in is sustainability and carbon footprint, on which you will be judged, and third comes price. That will send a very, very clear signal to market, and people will change dramatically, and those companies' supply chains will change dramatically as well. Then picking up on this business of meeting other natural targets and so forth, Sophie's comments on a natural nature service make a lot of sense. That I work in an intensive care unit, which is, in all honesty, utterly insane when the huge amount of money we spend largely goes on entirely preventable disease. And if we look at deploying people who are poor and socially isolated and giving them community and allowing them to work together in the green environment, which we know is good for mental and physical health, we will turn the tap off of impacts of climate change, but also on the mental, social and physical health impacts of impoverished communities. So we can tick a lot of boxes in one go here. It's just we need to start getting people to stop thinking about the machines I play with that go ping and that are very exciting, and of course we all feel we need suddenly in a crisis, and start turning the tap off, and people realizing that in fact healthy living is not about sackcloth and ashes.
Yeah, absolutely. Thank you. Yeah, those basic 4 principles of sustainable healthcare, and they're not they don't have equal value, do they? They're like a pyramid. So you've got prevention at the bottom, and then you've got your patient empowerment, your lean pathways, and then your low carbon alternatives. So it's sort of getting that mindset amongst all of us. There's a question here, it's sort of a bit of an elephant in the room in South Wales, but it's about the Valinger, plans to rebuild Valinger. So it's from Alvin Jones. Probably best to go to Sophie or Helen, sort of a Welsh representative, but the person has said the plans to build the new standalone Valinger Cancer Centre on the Northern Meadows in Cardiff, rather than co-locate with an acute hospital, which will destroy acres of irreplaceable meadowland, a nature reserve and thousands of carbon-absorbing trees, potentially creating dangerous flood risk for local communities, and will increase the carbon emissions while reducing air quality as a result of dangerous and polluting congestion. What is the panel's view on this in the context of the health sector in Wales needing to combat climate change and its effect, including the ecological emergency? Would anyone like to take that?
Shall I kick off on this, Fiona?
Yes.
it's fascinating, isn't it? We've been having some conversations with Velindre around this, and you know, our challenge to them was actually much broader than just this, but you know, it applies to UHWs doing UHW2, and we know that also in Howell they are looking at rebuilding a new hospital. And the challenge we put in was, well, actually in 5 years' time, or possibly more, by the time this would be built and established, we will see such significant changes in the way we would be working and the transformation in terms of the impact of technology. Our view is that whilst we've been sucking people for the last, 70 years into hospitals, our view is very much we ought to be turning that on its head and looking at how we can sustain and enable people to live healthy, active lives in their own environments. Now, as and when they need treatment, that may also be looking at, in terms of outreach, the ability to take treatments out in ways that we can't see now. And I think there is a real issue about building for today and continuing to build on today's kind of concept. And it is tricky, you know, we have to look at the future. I would say that whatever is built needs to have a fundamental eye on the whole context of the environment, whether it's the building itself and or the environment within which people come into the building to have necessary treatments. But there is a real transformation in thinking needed around the whole of that.
Thank you. Sophie, did you want to comment at all on that question?
I'm afraid I can't comment specifically on the Velindre issue because I am a local resident, live around the corner and use the Northern Meadows frequently, so I've had to declare an interest on that, so I don't want to get myself in legal hot water there. But let me talk about the sort of broader concepts. I think that there's a challenge in terms of us considering both what we decide to do and then how we go about doing it. And I think the position that we're seeing ourselves in many instances across Wales in our attempts to embed the Wellbeing of Future Generations Act is that we've already decided what we want to do. And we haven't necessarily always applied the Future Generations Act to those principles of what we decide to do, but we focus on how we're going to do it. So as an example, completely away from the Velindre issue, which I can't talk about, but as an example, you will see that, you will probably have seen that last week the Welsh Government decided that there was going to be a moratorium on road building. And that has come from a series of challenges on the national approach and strategy that I've been making around what is actually happening here in Wales is that we're deciding we're going to build roads, and then we're saying, well, actually, we're going to build that road though with, with solar or LED lighting, and we're going to have nature corridors along the side of the road, and we might put a cycle path there as well, which is all very welcome, but actually, it still doesn't get you away from the fundamental fact that you've built a road rather than investing in public transport. So I think that there are some significant challenges in terms of the culture change, which is required to shift us to both, what we do and how we decide to do it. I think there are still lots of elements of the system which is butting up against the Future Generations Act. So, for example, I've intervened in environmental permitting and how that relates to the Wellbeing of Future Generations Act. If we look at practically everything through the healthcare system, the performance targets upon which you are measured, the way in which the planning system has changed in line with the Future Generations Act, but how well is that being applied? So there are a number of things still butting up against that. I personally think that both the Act and the Commissioner probably need more powers. I'm the only commissioner in Wales that doesn't have a casework function, for example. So I have to operate at a strategic level differently to the Children's Commissioner, Older People's Commissioner and so on, who can get involved in individual cases. And I don't have powers in that regard. And actually, I don't have resources either. So if we're serious about embedding the Future Generations Act, I think we need to look at increasing those powers and certainly increasing the resources that we attach to implementing the Future Generations Act and holding people to account on it.
Okay, thank you, Sophie. Yeah, I think
sorry to interrupt, Freya, can I just make a point about campaigning for change for health? I mean, yes. I know nothing about the Berlindra or Northern Meadows, but if you want to make this go badly, you set up a false dichotomy about people who are living with cancer and people who care about the future of the planet. I mean, that is an unwinnable argument, sadly. What you need, if you really want to be ruthless, what you need is a group of people living with cancer who say, we do not want our hospital built on this land. You have to merge the factors, you have to merge the values to show, and you do not want to set up any false dichotomies. It's really, really important that you don't do this. This is about common humanity. It's actually rooted in very practical decisions about where you build a hospital. If you look at Alder Hey hospital built in Liverpool, it's a wonderful example of how you can be smaller, smarter, greener, cleaner, cheaper, healthier.
Great, thank you. Yes, I think it just goes back to those basic sort of development principles of, will this building improve the social value? So with regards to cancer care, modern day cancer care, should we actually be co-locating and not staying separate? Will it improve the economic benefits of Wales? And if you're spending an exorbitant amount of money on something which could cost a lot less, then that doesn't fit the principle. And then will it improve the environment as well? So it's a building on a greenfield site is the current model, whereas actually if there are alternative brownfield sites, then we should always be building on them. So those are the three main sustainable development principles. But I'm going to move on to one last question. I'm going to go on to one about physical activities. How does physical activity fit into the programme of prevention? And how can other public bodies work with the NHS to support a programme of prevention for health and the environment? So I don't know who that would be best suited to, really. Possibly Francis or Hugh?
I don't mind starting off. I mean, this is a really good point, because it's this issue of what's known in the trade as health co-benefits. So whilst focusing on what's good for the planet to protect our future health, it turns out that an awful lot of things we do right now are immediately massively impactful for our physical and mental health right now. And exercise is just one of them. So active transport doesn't just mean less carbon emissions and climate change and less particulate pollution with its attendant risks of malignancy, lung disease, coronary disease, potentially dementia, etc. It also means the positive benefits of exercise. So less obesity, diabetes, stroke, peripheral and coronary vascular disease, various cancers, etc., etc. So there's some very quick wins. And as you'll be well aware, those wins are very tightly coupled, as they are very often in public health. For instance, with cigarette smoking, those changes in myocardial infarction rates within 6 weeks of introduction of acts because of the acute impact of smoking as well as the chronic. So yes, I totally concur that moving very quickly towards active transport, for instance, and encouraging physical exercise is beneficial for the people and for the planet. And that fits, of course, with other things such as agricultural policy. So having local, vegetable-based, sustainable and seasonable produce as our core diet is good for our longevity and physical and mental health, but it's also good for our planet. And that brings us back again to these things we do individually. Well, yes, we should, but are they things we should be working with government to advocate and build in? Yes, they are. And should we be, though, talking to the places in which we work? My own hospital is a disgrace in terms of the quality of the food that's provided. It's unhealthy for staff and for patients, and it's not good enough. If I were in Wales, I'd be advocating for, you've got wonderful farmland with wonderful produce on your doorstep. What's wrong with actually locking that into your supply chain and saying, we will use that in preference to everything else, and we're not going down mass-produced and processed, because that isn't good for you. And it's a bad example to be setting as well. So yeah, a lot we can do individually and with our places of employment, I think.
Absolutely, thank you. Did any of the other panelists want to comment on that question at all?
I'm happy to come in. So totally agree with everything that Hugh's said there, and I think it's back to the points that I was making earlier about making those connections. Sometimes the most valuable things that we can do in terms of human health are outside of the healthcare system. And I think that there is a big challenge to the healthcare system on, so what therefore is your responsibility in light of the fact that the healthcare system takes up 50% of the whole Welsh budget. So I actually think what we need to be seeing is some shifts in funding from the healthcare system towards those things which focus on the wider determinants of health. And I think there are lots of things that we can do to have those multiple benefits. I can see someone's beat me to it in the chat, but 15-20-minute neighbourhoods. You know, the benefits you get from 15 or 20-minute neighbourhoods are that you reduce your carbon emissions through transport. You are building more cohesive communities. If you go back to the kind of snow days, remember when there were no cars on the roads and everyone was interacting with their neighbours and so on. And that's the sort of interaction you get when you walk and cycle rather than get in your car on your drive. You're also helping in terms of increasing physical activity and, you know, having an impact on addressing our obesity crisis. I think there's also things that we need to be looking at, and you know, again, don't want to go particularly back to the sort of Velindre scenario, but I think there's as much of a challenge for us questioning and challenging those poorer, more deprived areas who do not benefit from any of the leafy suburbs anywhere. And the fact that if you're poor and if you're from a BAME community, you are much less likely to have access to nature. So where is the focus on cleaning and greening those communities, connecting those communities back to our environment? All of that then has a knock-on consequence to our wider eco-literacy and the eco-literacy of our children. You know, I've made a clear sort of recommendation to government that we should strive to be the most eco-literate nation in the world, and that starts within our school system, but it also starts around how we plan, design and build our communities. So I think that there's certainly something about us you know, thinking more widely, being quite ambitious in recognising where those connections are. As I said, being willing to put our money where our mouth is, with some really brave stuff around redirecting resources elsewhere, but also some really immediate stuff like, you know, where are we procuring our food from to supply our patients in hospitals and so on. Is that coming from the local farm, or is that being shipped in at the lowest cost and the lowest monetary value and the highest carbon value from elsewhere?
But thank you so much for all the questions coming in. I'm sorry we couldn't answer them all, but thank you for all your answers. We're going to sort of close the Q&A now.